and Kaizen. And they both mean the same thing. Kanai is constant and never-ending improvement, and I stole that from my friend Tony Robbins. And Kaizen is a term that the Japanese use that means continual improvement, making things better all the time. And that's what you need to understand. It's about tweaking the process ongoingly, making life better all the time. So we're going through the 6 steps of making any decision process or making goals happen. Remember, life is a do-it-yourself program, but your health, more importantly, is in your control. Health is a do-it-yourself program, which, by the way, as you know, is the name of my book, and you can get that off our website at rosellecare.com. That go to ROSELLECARE.com and check it out, and you'll find some very interesting things. You can order my book from there, by the way. But we're talking about how to set healthcare goals. We're trying to put it together for you and make a very, very big difference in what you do this year. Remember, I said to change anything, you have to first decide that you want to change it. Secondly, you got to know what it is that you want to change. Most people fail simply because they don't know what they want to change. And that's why I need to change my health. I need to do something better. Well, what is it that you have to change? You have to list the things that are things that will move you towards that end piece, but you got to know what that end piece is. I got to get my blood pressure down. Down to what? I want to have a blood pressure of, and then list that, 118/68. I want a resting pulse rate of 58. I want to be able to walk 5 miles in and, set it an hour and a half or whatever it is. I want to be able to, and give yourself very positive goals. I want to be able to. I want to look like. I want a chest of so many inches. I want a waist of so many inches. I want a body fat of, so many percentages. And put that together so now you have a picture of what it is to look like you. And I said, if you want to really get leverage, and you have to get leverage on yourself, take a picture of what you are now in your underwear, blow it up, huge, and put it in your bedroom. Put one on the refrigerator. Put one in the bathroom. And then when you get enough pain by looking at that and saying enough is enough already, maybe you'll start developing the other side, the picture of what it is that you want to become and how you want to become that. Clark, how can I help you, sir? Thank you for calling.
Yes, good morning. I had an operation on my ankle about 6 weeks ago to repair a broken ankle.
Yes, sir.
And thank goodness the x-rays show that the bone has healed. But I'm still having trouble with post-op swelling in the foot and the leg. I do exercises 3 times a day to strengthen the ligaments that were also damaged at the same time. And every time I exercise, my foot swells up and the leg swells up, and I have to elevate my leg for about an hour or so afterwards to deal with it. And the swelling in the foot just seems to never go away.
How long ago?
Which really impairs my ability to try to walk on it.
How long ago was the surgery?
6 weeks ago.
Did you have metal put into it?
Yes.
Okay. So the thing of it is that just because it's been 6 weeks or even 7 or 8 doesn't mean that you're totally healed. As a matter of fact, for any kind of surgical intervention, and the fact that you have a fracture and they put metal in, you got 6 months minimum. And unfortunately, that's the length of time that it takes all the tissue to really toughen up and be strong. Now, understand the process. When they go in and do that kind of surgical intervention, it's unavoidable. They're damaging tissue, lymphatic systems, and so forth, and it takes a while for the body to reconnect, nerve systems and the like. Now, what you can do to help yourself is there's a good homeopathic preparation. It's called Traumeel. It's like trauma, Traumeo, Traumeel. And you can get it at any of the health food stores. Take that and rub it on. It's a gel, and put it on there maybe 3 times a day. Massage your foot from your toes up towards your knee, almost like a straight line running from your toes on the side of your foot, on either side, up the side of your legs, very gently, almost in a circular pattern. What you're doing is you're going to massage not only the lymphatic system, but you're also going to encourage the acupuncture system. Now, having said that, those are things that you can do on your own. One of the most effective things post-surgically is acupuncture and low-energy light laser. It's used by multiple teams in the NFL. The guys are using it to expedite the healing process so they can get these people back on the courts, on the fields, and on the ice, and it makes a monumental difference. But there's several things that you can do, as we talked about, and that is a thing that you can call us or call somebody who does the kind of work that we do, and that will help you heal as well. But it should make a difference.
How do you spell that? Trimeal again?
Trauma, like Trameal, Traum, Trameal. Instead of the A at the end, go EEL. You can get it at Whole Foods, you can get it at Mom's, you can get it at Healthways, you can get it at, even GNC carries it. Anyway, I hope that helps. If I can be of more help to you, Clark, please give me a call. Thank you for your phone call.
Thank you for your time. I really appreciate it.
You're more than welcome. You're listening to Dr. Tom Roselle Live. This is Dr. Tom Roselle, and we're talking about setting your goals for 2011. Love to talk to you on any subject you have in mind. We're talking about making your health the best it's been in many years, starting maybe for the first time in a whole long time, and getting yourself back to where you are enjoying the birthright that was given to you at the time you walked into this planet or came screaming into this planet, or ever how you came in, you know. The deal is that most of us aren't living at the level that we should, physically, healthfully, energetically, and you can change it. And you need to look around you, see what it is that you want to change, make a decision to change it, and then we have to take action steps towards that goal. You know, if you're a smoker and you know that's bringing up your blood pressure or it's hurting you in any other ways, it's bad for your heart, your smoking started for a reason. It either gave you some significance, having that cigarette in your hand. It gave you the sense of some type of certainty in your life. It gave you something. And you got hooked because the chemical induction of that cigarette, it was the most addictive thing you could do, almost worse than heroin. If anybody's tried to quit, but you know, anybody who quits anything and moves towards something much more powerful has to have two things. You have to say enough is enough and create such emotional pain and baggage that you have no other option, that you have to quit or you have to change. You have to do something differently because where you are right now is not okay anymore. But the second piece, and more importantly than the first piece, is that you have to want to move towards something that's more empowering. So you have to take action. So remember we said, if you make a decision to do something, you have to take action. So here's what you do. You have to do something. Let's talk about the cigarettes. How about an action step of rolling down the car window, reaching in, getting the cigarettes, and throwing them out? Is that symbolic? Is that a first action step? Well, yeah, I would say that's like total commitment. That's like, I'm done already. And then you go and you clean out your ashtrays and you're all set. If you can't do that, let's put together a step-by-step procedure how to quit. First, the emotional piece. It's not about I have to. I'm done. I'm finished. I'm quitting. It's over with. And you can go get the patches and you can do all those things, but now set up your environment. Clean your clothes, clean out the ashtrays, wash your house down, open up, go get an ionizer, clean it out so you can't smell it anymore, start staying away from the situations that are going to put that cigarette in your hand. And if you have to break down and have a cigarette, force yourself to go outside and stand on the porch and have that cigarette. Force yourself to go out into the parking lot. And then visualize yourself as this person who's standing out in the rain, in the cold, in the snow, and so forth, having that cigarette because they are so addicted they can't get away from it. But at least set that up and create more pain until you get to that place where you're done. But now we have to create that image of who we are and what we want to move forward to. How about if you got a heart problem and you have an irregular heartbeat and they're telling you, well, I don't know why you have the irregular heartbeat, but it has to be, something wrong with the pacemaker in your heart, and we have to do, either a chemical block or we have to do an electrical block or we have to do something. Then ask yourself the question, what is it in my environment that I'm doing that may be causing this? Take a look at your diet. See if you're eating the things that you need to be eating. See if you're putting poisons in your body, sugar, sodas, coffee, teas, fast food, fried foods, alcohol, junk. See what's going on there. And then take a look in your surroundings. Are you walking? Are you inside all day long? Is your vitamin D level too low? Once we take an action step, once we begin to identify things, now we've got to create a plan. We have to do something differently. See, because if you visualize it, you see it, and you begin to own it, but you don't create a game plan to do it, you're never going to reach it. And I don't care what you're suffering from. I don't care what the process is that's going on in your body. You can change something, but you have to create that emotional pain. You have to decide what it is that you want differently, and you have to move towards it. So let's list the things that we want on this canvas. Let's say, I want to be able to walk 5 miles, and I want to be able to have a body fat of or a cholesterol level of and so forth. And let's figure out how we're going to do it. We're going to start walking every day, maybe 2-3 minutes, and we have to move towards what it is that will accomplish those things. Because I don't care if you're 500 pounds, you can begin to change your physiology. You can begin to change your health, no matter what. If you have inflammatory reactions in your body and you're plaquing like crazy, you can begin to change that. They will begin to reverse the process. And it's not going to reverse it because you're on a statin. As we've talked about so many times, taking a statin to lower your cholesterol is not about what's happening. Cholesterol is there, has to be there. It's good for hormone production. It's good for brain transmission. And the only problems that you have is that you're doing something in your body that's causing a high level of inflammatory response, that's taking that cholesterol and sticking it to the arteries to protect you, to keep you from having acid burn through your arteries. So we have to look and see what that is. We have to look at the characteristics of what we want to do and to accomplish. It's called mirroring. Find somebody who does exactly what it is that you want, and let's move towards that process. There's always somebody who's done it, right? There's somebody who's out there that's great. There are people who have done everything that we want to accomplish and perhaps more. So how do they do it? What's their mindset? Are they positive, enthusiastic about life? They have to be totally committed. They have to see themselves as if. And then you know what you have to do? You have to expect more of yourself. You have to expect much more of yourself than anybody else could possibly expect of you. And you have to develop the attitude that you're going to be very adaptive. You're going to be a changeling. You're going to change your colors, so to speak. You're going to move towards. You're going to do something very different. Have you ever watched The Biggest Loser? It's one of my favorite programs. I love to watch that thing. I come home, I turn it on, I eat my dinner watching this thing. And I see these people that are really dead in the water in their lives. They're huge, and they have all kinds of health problems. They have heart problems. They have blood sugar handling problems. They have joint spaces that are degenerating. They have, the potentials for all kinds of devastating pathological process. And here they do. They take them, obviously, in a controlled environment, and over a period of weeks, they change their life. Totally 100%. They change their life. So we have to know what it is that we want to accomplish. We have to decide to do it. And then we have to look around and see what are our resources. What do we have to surround ourselves to? Maybe there's a gym down the street. Maybe there's a community center. We're going to get back to that. Hold that thought. Mary, how can I help you? Thank you for calling. Happy New Year.
Hi, Happy New Year to you. A very healthy one and very content one.
Very excellent.
We can all use that, and I'd like our soldiers home tomorrow, but I had to add that. I wanted to ask about blood pressure, which you had mentioned. I want to know three short things perhaps you could give. I know you could go on for hours, but short response. I want to know what causes high systolic and along with high diastolic. And secondly, what would cause a high systolic along with a low diastolic? And the last one is, what would cause a low systolic with a high diastolic?
That even giving short answers to that is not going to be easy. So let me just tell you what happens with blood pressure of any kind. Blood pressure is a response to two things: the amount of pressure that the heart has to exert to move the blood through the arteries when the heart contracts. The diastolic, the down pressure, is the amount of pressure that's left in the vessels after the heart contracts. So you have different things that you look at. You look at kidney function, you look at mineralization, you look at the amount of fat that's in the system. If the pressures are very, very close together, you look at narrowing within the aorta, which is the main artery that comes off the heart that feeds most of our body. You look at the stress patterns that are there. if somebody's under stress all the time, they never let it go, they're an angry type of thing, or they're internalizing things, your diastolic pressure is going to come up because you're always in a state of tension.